The fourth heart sound is an extra sound that occurs in late diastole just before the first heart sound. It is low-pitched and requires the bell of the stethoscope to be applied lightly to the chest with the patient in the left lateral position. Listen to a fourth heart sound. I will begin with 3 normal beats and then add the fourth heart sound. The fourth heart sound is an indication that the ventricle has become stiff and non-compliant, often due to hypertrophy. This stiff ventricle requires a more forceful atrial contraction for adequate filling. The forceful atrial contraction generates a fourth heart sound. In many patients with hypertension, the left ventricle becomes hypertrophied and eventually non-compliant. This can lead to an audible fourth heart sound. Although hypertension is a common cause of a fourth heart sound, there are other causes, including aortic stenosis, hypertrophic cardiomyopathy, and ischemic heart disease, which can result in the ventricle becoming stiff and non-compliant. A fourth heart sound is normally faint, and it is heard best at the cardiac apex with the patient in the left lateral position. This position brings the heart closer to the chest wall and can dramatically improve the loudness of a fourth heart sound. When an extra heart sound is added to a normal first and second sound, a triple rhythm is created. This triple rhythm is called a gallop, and in the case of a fourth heart sound, it is termed an atrial gallop. The fourth heart sound originates in the left ventricular wall, but it requires a forceful atrial contraction to be audible. This forceful atrial contraction is necessary to fill a left ventricle which has become stiff and non-compliant. In addition to being audible with a stethoscope, some fourth heart sounds are also palpable. A palpable fourth heart sound feels like a double impulse at the cardiac apex. There is controversy over the significance of a fourth heart sound in patients over the age of 50. While a fourth heart sound may be audible in normal older patients, most experts agree that if a fourth heart sound is also palpable, then it is an abnormal finding. In summary, a fourth heart sound is a low-pitched, late diastolic sound heard best at the cardiac apex with the bell of the stethoscope and the patient in the left lateral position. The fourth heart sound indicates a stiff and non-compliant ventricle, especially when it is palpable.